Good afternoon. This is Carmen A Wabegijis, Director of Health and Community Wellness for Attikmekshing and Anishinaabeg, and I think I'm on. Oh yes, okay. Sorry, I thought I had my mic off. Okay, so welcome to this Thursday's Health Q&A for this week. We do have a panel of Marina McComber, our community health nurse, who will speak about isolation center and kits. We have Amanda Wabegijis Jordan, who is our health promotions manager, and she will speak on the wellness checks and an overview of her programs. We have Lisa Grew, who is our home care manager, and she will provide an update on the home care program. And then myself, I'll begin with just a brief overview of what is COVID-19, because I understand, we do get a lot of information from the TV, the news, and the different sources that we have. So it will be just a brief overview. The symptoms, they've attached new symptoms as well as of April 22nd, and then some stats. So I will just begin. So what is COVID-19? As many of you are aware, COVID-19 is a serious respiratory illness caused by a virus that is believed to have recently jumped from animals to humans and can spread from person to person via close personal contact, coughs or sneezes, or infectious droplets left on frequently touched surfaces. The most common symptoms of the illness are a new or worsened cough, fever of 38 degrees Celsius or greater, and difficulty breathing. Though other symptoms have been documented include diarrhea or loss of inability to taste or smell, most infected individuals will experience mild symptoms through very serious illness, and death can occur in individuals of any age or health status. It is possible for infected individuals to show no symptoms and spread the disease or spread it before developing symptoms. Though this remains under investigation and is currently not considered to be a primary means through which the disease spreads. The newest symptoms received from Ministry of Health on April 22nd include sore throat, runny nose or sneezing, nasal congestion, hoarse voice, difficulty swallowing, taste disorders, nausea, vomiting, diarrhea, or abdominal pain. So if you need to make a phone call to Marina or your healthcare provider, if you're experiencing any of these symptoms, along with the temperature, increase in your temperature, make those calls. Marina is on the panel today, and she can provide you with her number. So statistics. Statistics in Ontario, we have 347 new cases were reported today in Ontario, bringing the cumulative total to 15,728. In Ontario, a total of 264,594 tests have been completed, with tests performed at Public Health Ontario laboratories and non-public health laboratories. There are currently 9,530 tests under investigation. There are 977 patients are currently hospitalized with COVID-19. 235 are in ICU and 186 are in ICU on a ventilator. Statistics for public health, Sudbury and District area. So as of April 29th, 2020, Public Health Sudbury and Districts is reporting a new COVID case in a residence in our service area, which brings it to a total of 58 cases. Statistics for Attikmekshing and Anishinaabeg. To date, we don't have any statistics. So if you are going for testing or you've found out that you're positive, please contact Marina McComber, community health nurse, or myself, and we'll be able to help you. Public health will also advise and do some contact tracing, as well as our community health nurse. As a reminder, I'd like to remind everyone to stay home. If you have to go out for essentials, please remain 6 feet away from others. Do not touch your mouth, eyes, or nose, and always wash your hands for 20 seconds. If we take all of these precautions, we can keep each other safe and not spread the virus. I will go on to the next panel, which is Marina, and she will talk about the isolation center.
Okay, thanks, Carmen. I just wanted to talk about the isolation center that we're opening on the First Nation. The isolation center is in a location which individuals who are required to self-isolate as per recommendations by medical professional can do so if they're unable to isolate safely at home. For example, if their house is too crowded or they are cohabitating with elderly or immunocompromised individuals. The isolation center is only for individuals who will be able to care for themselves. If a person needs to self-isolate and is too sick to care for themselves and cannot be at home, they should be at the hospital where they can receive proper care. There will be 2 locations for the isolation center, the early years center and the community complex. Having 2 locations enables separation of persons with a confirmed diagnosis from others who might not have COVID-19 but would still need to self-isolate. For example, because of travel or close contact with confirmed cases, or if awaiting results. Occupants of the isolation center will be given food and lodging and will be provided with a means to maintain cleanliness of their personal areas, but will otherwise be expected to have brought with them the means to remain in isolation center for at least 2 weeks. So sufficient clothing and personal hygiene items. All individuals who need to self-isolate, whether at home or in the isolation center, will be given a package with hand sanitizer, disinfectant wipes, masks, and other supplies necessary for self-isolation. And if you have any questions, or if you have signs and symptoms of COVID, you can call me to my cell number, 705-507-0134. Until we meet again, everybody stay well and stay safe.
Okay, thank you, Marina. That's good information. So now we will move on to Amanda Wabegijis Jordan, who will talk about the wellness checks, providing that update and her program updates. Welcome, Amanda.
Okay, so hi, my name is Amanda, and I am the Health Promotions Manager. For our wellness checks update, there's been no extraordinary requests being made. We are doing follow-up check-ins weekly, but there's hasn't been any issues reported this week. From the latest tracking report on these wellness checks, 229 people responded. This includes family members, 140 homes. Majority of people are okay and well. The majority of responses are yes, they are prepared for self-isolation. There are 8 individuals responding that they are not prepared for self-isolation, and 3 respondents had advised that they are worried or have anxiety. So seek out that help for those issues. As for our health promotions unit, this includes our patient transportation program. Darlene Govro, who is our health services clerk, her number is 705-698-6818. So if you have any appointments that you have to get to, please contact her. We've also added in prescription pickups. So If you have any of those, please contact Darlene and schedule in your transportation. We've also hired on a contract basis, it's Zachary Marinier to our team as a patient transportation driver. So he'll be with us until the end of June. Just for a program update also, there is no stopping at any fast food restaurant during any medical trips or prescription pickups. Yeah, so those fast food stops, restaurant stops will end. There are new procedures and processes in place to keep you and our driver safe, so keep washing your hands consistently and use the hand sanitizers that are in the vehicle. If you feel symptomatic with the coronavirus and are looking for transportation to the hospital, you must speak with Darlene Govro and a healthcare professional before entering into the medical van for your health and safety and for our driver. There are protocols and procedures in place for us. For the Healthy Babies, Healthy Children, Beverly Belanger has a new number. Her number is 705-690-7503. She will be administering the CPNP vouchers program. So if you are pregnant or breastfeeding a child under the age of 1 year, you are eligible for these CPNP vouchers. Contact Beverly to receive the resources and benefits available for you. The Early Year Center will be demolished this summer to make way for our new Child and Youth Center. Beverly will be cleaning and clearing out the Early Year Center. If she has any items available for families to take, she will post on her Facebook page. Beverly will continue to post information and activities that you can do with your children on her Facebook page. She is having a May strollers walk. Yeah, May stroller walks. Send in your picture of you and your family out walking to Beverly. The deadline for pictures is May 15th to receive a gardening kit or a Battistelli's card. There's something that she'll be handing out. Our child and youth worker also has a new number. Her number is 705-690-7513. On Mondays at 4, she continues to do her Zoom parties. Tuesdays at 3, she does questions of the week. On Thursdays at 4, she does an update on the Come Grow With Us program, that's for gardening. And then Friday, Facebook Live sessions at 5. She's also having a jelly bean contest that starts May 2nd. So she'll post the picture of the jar with the jelly beans and you send in your guest to her. She is also having a craft night on May 15th. So sign up to make the dream catcher and she'll give the deadline to sign up. Our community physical activities programmer, he has a new number also. His name's Liam, 705-690-7346. So in his May calendar, he has weekly challenges, daily, weekly challenges for everybody. It's quite interesting. I know I'd probably have difficulty doing it, but I'm going to try. So send in pictures and your progress to Liam to be eligible for a prize at the end of the month. If you have any fitness goals and would like assistance in achieving these goals, please contact Liam. He is a personal trainer also. So yeah, that's our unit.
Okay. Miigwech, Amanda. Now we'll move on to our last panel, Lisa, and she will talk about the home care program and provide an update for that.
Thank you, Carmen. So I'm giving an update on our home care program. I think everyone is aware already that our Diners Club program has changed to a Meals on Wheel. And so there's been an increase in the service since the COVID-19. We now have 57 people receiving meals every Wednesday. And if there's leftover food, she also feeds the volunteers. So that's a big increase from the Diners Club program that she was doing before. So I'm hoping that when things return to normal, that all these people will be coming in for her cooking at the community center on the Wednesdays. The adult day programmer is, she's not doing a transportation program per se, but she is offering one-on-one support to community members and home and community care clients. Again, we need to remind people that she's not taking anybody over the age of 70 out shopping. If they need to go and do banking or post office, she'll take you to go and do that, but not to the grocery store. Any shopping that you need done, you can do a list and have the money ready for her, and she'll go out and do your shopping and deliver it to your home. And while she's doing this, she's making sure that she keeps the van clean. So she cleans and sanitizes the van in between each person that she brings out and in between each shopping that she does with for the clients. And that's for the safety of her and for the people in their community. The adult day programmer is also doing one-on-one check-ins with the community members. So she's on the list with everybody else who does all the phone calls to community members to make sure that they're okay. She also helps out with the Walden Food Bank. So she'll bring community members when they call in to go to the Walden Food Bank. They've reopened and you can go there once a month, as well as with their Legion program offered out of the library. So if you need help with getting in touch with any of those services, you can get a hold of me and I can forward information to Lindsay, or you can talk to Lindsay yourself. She's also going to be continuing on with any land-based program that are not group situations. So she'll be working on the tobacco project with me. And a reminder that all adult day group programs are canceled until the end of this pandemic. As for the PSWs, they're still going into the client's home to provide personal care and support services. They are taking precautionary measures when they provide their care. So they screen themselves before they come to work, and then they do the same screening with the clients before they go into their homes, if at all possible. And they've also been wearing protective equipment such as a mask, gown, gloves. They've been doing extra hand washing or sanitizing or both. And that is to ensure that they're protecting themselves as well as the people that they're working with. The PSWs have also been covering the adult day worker when she's off, so they'll do the one-on-one client and community support. So to help people go shopping and do their errands that need to be done. They've also been delivering meals to community members on Wednesdays from the Meals on Wheels program. And they've also started training sessions in relation to COVID-19. So they're learning how to properly use their masks, how to properly take off and put on their gloves, and how do you wash your hands properly? How do you keep your clients safe? I also have one message from Kim Reckley at the health center, and she just got a reminder from the Sudbury District Health Unit, and they're recommending that any community member over the age of 65 get their pneumococcal vaccine in order to protect you from pneumonia. And her extension is 248 at the health center. The phone number is 705-692-3651. Her extension is 248. Thank you.
Okay, thank you, Lisa. Very informative. So that includes our panel today. I hope you did find the information very useful. If you do have any questions at all, you can always contact one of the managers or Marina or myself, and we would be happy to help you and help answer any questions that you might have. Miigwech, Bamapi.